Good morning. My name is Daria Bennett. I'm the administrative assistant here at Home of Hope Cancer Wellness Center, and today I will be talking about Social Security benefits and how they correspond with a cancer diagnosis. You may ask yourself what Social Security is. It's any government system that provides monetary assistance to people with an inadequate or no income at all. How does that align with a cancer diagnosis? By qualifying for Social Security disability benefits for cancer, it can be pretty straightforward for some aggressive cancers, such as pancreatic, liver, thyroid, mesothelioma, and esophageal cancers. For others, you'll need to provide the Social Security Administration, or the SSA, with convincing evidence to show that either one, your cancer fulfills the qualifications for the SSA's disability listing for that particular cancer, or two, the symptoms or treatment for your cancer limit you so that you can't work much. Social Security disability income is one of the programs that can help. The SSDI program pays income benefits to people who are disabled. Benefits may also be provided to certain family members as well. You must have worked and paid Social Security taxes for a certain number of years to qualify for this program. The Supplemental Security Income, or the SSI program, is a program that pays income benefits to disabled adults and children who have limited income and resources. Benefits may also be paid to people over age 65 who are not disabled if they meet the financial need requirements. Medicare is a federally health insurance program that includes coverage options for prescription medication, your doctor services, and hospital visits. This program helps with the cost of healthcare, but it does not cover all your medical expenses or the cost of most long-term care. Medicaid is a partially federally funded healthcare program administered by the individual states. Each state sets its own income and disability eligibility requirements and service guidelines. Medicaid does not pay income benefits, but sends your payments directly to the healthcare providers, such as the doctors and the hospitals themselves. How do you know if you apply? By reading the federal and state programs before you apply for benefits, you can learn about the medical requirements that make you eligible for benefits. Here's who you contact and the tools to help. It's very important to contact the U.S. Social Security Administration, or the SSA, your local Social Security office. There's a benefit eligibility screening tool, and govbenefits.gov shows all the benefits that you would be available to. What if you can't work? While many cancer patients can undergo chemo or radiation and continue to work, for others it's the cancer treatment, not the symptoms, that makes it difficult or impossible to work. Chemotherapy and radiation can also have significant impact on your ability to function normally. However, it's difficult to get disability solely because of chemo or radiation treatments because of the SSA's time requirement. The SSA requires that you are unable to work for at least 1 year. Often the negative side effects of chemo or radiation are just temporary and they fluctuate over the course of treatment. Because side effects fluctuate, the SSA will require a more sufficient passage of time for the start of chemo or radiation treatment to determine the ultimate effects of the treatment on the patient, both to see if the treatment was successful and to see if you were unable to work for over a year. It is very important that you document your side effects both in a personal journal and with your physician. It may also be helpful to provide a statement by another person who has witnessed the treatments, how they have affected you, whether it be a caregiver, your employer, things like that. When you have long-term side effects from a cancer diagnosis, many cancer survivors suffer permanent side effects from their treatments for cancer. Often, these complications do not appear for months or for years following the successful treatment for their cancer. When the long-term side effects of chemo or radiation are disabling, it's easier to get Social Security disability benefits than for the short-term effects. Chemotherapy has been associated with the following long-term impairments: heart problems, you may develop liver problems, a lung disease, some bone weakness, cataracts, and reproductive disorders. Radiation therapy has been associated with the following long-term impairments as well: heart problems, eye problems, hypothyroidism, reproductive disorders, lung disease, intestinal problems, cognitive dysfunction, and bone weakness as well. If you develop any of these conditions as a result of your cancer treatment, the SSA will evaluate the impairment on its own without consideration of the cancer. For instance, if you have heart problems following chemo, your condition would be evaluated as a cardiovascular disability. When you become disabled due to cancer, to determine whether you were disabled prior to the time of your cancer was found by to be untreatable, the SSA will consider the following factors. When you first reported symptoms to your doctor, what type of cancer you were diagnosed with, where the cancer is located, and how far the cancer has spread when it was first diagnosed. Usually your benefits are awarded up to 6 months prior to when the applicant was first diagnosed, unless there was sufficient evidence to prove otherwise. When you will be considered no longer disabled from cancer. If your original cancer or any metastases or tumors that have spread have been successfully treated and there is no evidence of their recurrence for 3 or more years, then your cancer will no longer meet any of the SSA's impairment listing requirements. This is a durational rule for cancer that is known as the 3-year rule. Alternatively, the 3-year rule also means that if a disability benefits are awarded to an applicant because of his or her cancer, the disability award will stand for a minimum of 3 years, even if the cancer seems to have been successfully treated prior to the end of a 3-year period. When you should consider a consultation with a disability attorney. Although some disability claims involving cancer are pretty clear-cut and may not require legal assistance, as in cases involving a stage 4 or terminal cancer patient, the majority of claimants will greatly benefit from hiring a lawyer to represent them. A disability attorney will understand how to prove that your condition meets a listing or how to demonstrate that the side effects of your treatment prevent you from engaging in a full-time employment. Disability attorneys generally provide a free consultation, and you don't have to worry about a fee unless you win a case. How you can apply. By preparing your case, reading about each benefit program, understanding that it is required before what is required before you apply. This will help you to include the documents that are needed, such as medical reports. By reading the list of impairments from the SSA, reading what qualifies you as disabled, the SSA website provides a very good informational packet about the medical proof that is required. By talking with your healthcare team about applying for disability benefits, asking them to write down treatment side effects and physical limitations in your medical records. Tell them about your symptoms, give examples of how this is affecting your work and personal life, ask that this be noted in your medical records. This information will be important to the SSA as your medical records are reviewed when you apply for benefits. If your provider believes you should not work it for a time, ask him or her to give you a note or a letter stating why you should not be working. Consider your provider's opinions and recommendations about your ability to work. If you and your provider do not agree, you can seek other medical opinions as well. To qualify for benefits, proof of your disability is required from a healthcare provider. It's very important to keep good records, keeping track of all the letters, bills, and claims information. It's also very good to keep notes and discussions about dates when you and your healthcare team and insurance and others spoke. Writing down dates, names of people, and what was said. These records may be useful if there are any questions or concerns in the future. It's very important to keep copies of information received from or sent to insurers' benefits programs. Home of Hope is here to help. If you have any questions or concerns, please reach out to us or to your medical provider. I'm very thankful for you joining me today, and have a wonderful day.